Can you talk us through some of what your concerns are around the Border Force patrols?
Yeah, absolutely. We're really concerned about two things. One is the incredibly low rate of vaccination for this priority group, and the second is the issue of testing that you raise. The National Marine Unit are the ABF officers who patrol the northern borders. They're out at sea for weeks at a time. They come across fishing vessels from countries to our north where we know that there are really significant COVID outbreaks. And this is one of the reasons why they were in the priority group from the start of the vaccination rollout. But we now are in July. We only have 25% of those staff fully vaccinated, and over half, 52%, have not had a single dose. And we don't think that's good enough.
If I can just butt in there, the Border Force has responded in a statement, and in that statement they say 88% who are classified as 1A have received their first dose. Border Force say they allow people to go and get vaccinated and encourage people to do so. And they can do it in work hours, and they offer day in lieu as well. And 95% of ABF staff working at Sydney Airport has had at least one dose. So it seems like from their numbers that the vaccination rates are pretty high.
Yeah, the numbers that the department are providing there are for the department as a whole. So people who work for Home Affairs and ABF at Sydney Airport, Tullamarine Airport, etc. What the union is specifically talking about is the National Marine Unit, which are the ABF officers that board those ships out of Cairns and Darwin and Perth and patrol the borders. So the rollout has absolutely been better. We know nationally the rollout has been had some difficulties, but the rollout has been better in those major airports. The problem for these workers, the NMU officers, is they are at sea a long time, and actually they have found it difficult to get access to the vaccine when they're back at their home base because of the nature of their working situation and those really long rosters where they're away from home.
So what's the solution there, considering they're at sea for so long? And have these staff actually communicated that they are quite worried about COVID infection?
Absolutely. They're communicating with us that they're quite worried about infections. They're worried about coming off a boat and going back to their community, often over state borders, and unwittingly carrying the virus to others. So we want the solution. We think the solution should be for the department and local health authorities to facilitate vaccination as they depart the vessel. It is not a huge group of workers, but they do face significant risks, which is why they were always an early priority group. And we think the government and the department does have a solution that can be taken up at this point.
Now, can we just talk about testing? In this statement from Border Force, they said COVID testing is available on some ships, but where it's not available, it's not feasible to do so. Are the testing rates among Border Force staff on the front line intercepting vessels up to scratch?
Look, we are really concerned about this as well. On 2 of 13 of the vessels, there is testing facilities, testing capacity aboard. On 11 of 13, there are not. What we would like to see is routine testing as people come off the boat. We all know that you may have COVID and not know about it. You may be asymptomatic and so on. There's got to be a better approach. It's not easy, of course. These people are on vessels for weeks at a time out at sea, but we know there are really significant risks, and we need a better approach that provides that testing, particularly for all of those vessels where it's not available aboard while they're out at sea.
Once the staff come back from their long stint of being on a vessel, are they required to then go into 14 days of quarantine?
No, the arrangements differ. The testing arrangements as people come off the ships, if you have symptoms, you facilitated a test, or if you're a close contact of a known case. But of course, the nature of these interactions at sea with fishing vessels and so on, there's not really the capacity to identify known cases, etc. People then come off the ship and go back to their home base or their home port. So we do think it is a risk. We really want to work with the government and the department to get a better level of testing to make sure these people are safe and make sure their communities are safe.
So in summary, you're not satisfied with this response that has been issued by Border Force?
Look, there are many facts in this response that's been issued by Border Force that we don't agree, that we would agree with rather. There have been a whole range of vaccinations, and the numbers that you quoted earlier in the interview go to other key Border Force and Home Affairs officers. But even on their own numbers, the numbers they provide us, the numbers they've used in the media, more than 50% of these National Marine Unit officers have not been vaccinated. And that's just not good enough.
Well, Melissa Donnelly from the CPSU, thanks so much for your time. Always a pleasure.
Thanks, Kenny.